Zoom recording, and thank you everybody for being here. This is a special meeting of the Halifax Selectboard. It is Friday, November 14th at 6 p.m. and I am calling this meeting to order. And my first question is whether there are changes or additions to the agenda.
I don't have a change, but I'd like to ask if we can have a hard stop at 8 p.m.
We can.
Unless somebody has a
What are we doing?
hard stop at 8 o'clock,
Oh, sure,
Okay,
we're on it.
that'd be great.
unless you guys have,
You
we're
good?
good, 8 o'clock.
8 o'clock. And then the other thing I want to do is I want to take 5 minutes at the end just to talk about our agenda, because we actually do have a regular meeting next Tuesday and I want to make sure we capture anything because we haven't gotten ahead of the game with that. Okay, so we'll get into the agenda because I guess I left it out.
Anytime is 6:01 in the recording.
Yeah, we are recording. Emily is a co-host. Karen and I are co-hosts so that we can share as needed throughout the meeting.
I am here. I'm just on mute.
Okay, perfect. That's fine. Except for when I call you, then you have to come off mute. So we have two pieces of business today. We're gonna review and discuss healthcare information, and then we're gonna talk about budget for FY 27 and kicking off that process, looking at kind of an overview and objectives, our process. Do we want to switch hearing of visitors to earlier? Or do we want to? Yeah.
Yeah.
All right, let's do that now, if that's okay with people.
As long as it's a hearing visitors pertaining to budget, not non-budget items.
Well, hearing visitors, it allows them to say anything, but if it's not an agenda topic, then we would probably defer a full
Okay.
discussion till the next meeting. So, Keith, do you have anything for us?
No, right now.
Okay, Vicky?
Not right now.
Okay, Mike?
Nope.
Okay. Derek, no. Wade, no. Okay, I'm just keep saying no. Anybody have anything to say? Okay, and then Stephen online.
No, thank you.
Okay, and it looks like you're not muted at the moment, so if you get any background noise, we will remind you to do that. All right, so there was a brief discussion of healthcare information at the last meeting. We should say we're talking really about health insurance at this point, not healthcare so much, so it probably was a poor choice of words on my part for the agenda item. And to set the stage for this a little bit, everybody, I'm sure, has been hearing about the challenges with healthcare that seem to really have, health insurance that seem to have really come to the head, not just in Halifax, but basically across the entire country. And so I'm very cognizant that these are big issues. And I found somebody who wrote a really nice summary of all of the reasons that healthcare and health insurance costs in particular have soared at a much higher rate than the rate of inflation across the board. And I looked at it and I was like, yes, all of these things are a problem. And then I felt kind of a huge amount of despair because I can't fix that stuff, right? What we can focus on is what do we want for our employees here in the town of Halifax. And so what I started to do was to just take a look at where are we right now in terms of what we've spent on health insurance, what we budgeted last year for health insurance. And to give myself a little bit of a level set, because I remember last year budgeting for a 5% increase in the second half of the year for the health insurance. And I was like, 5%, okay. So we budgeted about $174,000, is 174.5 or 174.7 or something like that.
144, 692.
690, yeah, okay, I had 93, but all that to say, we budgeted that much. Then I asked Patty, how much have we spent year to date? which is for 4 months worth, and then that's $62,000 has been spent so far this year. And then, the way that health insurance works is we have a fiscal year that goes July 1st to June 30th. And the insurance, we know what it's gonna be for half a year, and we don't know what it's gonna be for the other half of the year, because that runs by calendar year. So the expected 6-month spend, based on our current plans for our employees, is $93,240. That will be to the end of the year.
Yeah.
And the amount left from the budget then was only 81.5 roughly, okay? So what I realized is, okay, somehow we're starting off with a deficit, and that has to do with the fact we had staffing changes last year. And so while we budgeted that 5% increase, we had a change in the plans that were being used by our employees. And so we are gonna have a deficit. Even if there was no rate change, I am expecting we will have a deficit on this line item of $11,787. So, if we were to continue with our current plan, we would have a deficit at the end of the fiscal year of $16,812.48. All right.
So I'm sorry, I'm just catching up also for the minute. So the current deficit is how much you said, 11,000?
With no rate change, it would be 11,787, but we're gonna have a rate change
Right.
of some sort.
That's to the end of the calendar year.
That's to the end of the fiscal year,
The fiscal.
Which is
year.
June 30.
Yeah.
Okay, and so, but the 16,812.
812 would be if we go with the current
Okay.
plan and the current configuration of plans, the current types of plans for employees, we would end up with a $16,800 deficit. Yes, ma'am.
How long are you doing for this time?
This one, because we have a lot of people who are here to speak about it, I
We
would
do the
say
whole 2 hours.
we take
Yeah.
what we need. We take what we
Yeah,
need.
no time.
We
Okay,
wanna-
no time? Okay.
Yeah, so what you wanna do is tell us when we're at 7, if we still are going, just to kind of give us
Okay.
a heads up. Thank you for that.
Yeah.
Linda. All right, so that's where we're starting, but not because we didn't budget for an increase, but because we have some changes, and those are, good changes. We are taking care of our employees, and we're taking care of our employees' families. All right, so then the other thing that I did, which I don't want to get into tonight, but I want to let the board and let the staff know that I've done, was I've actually done year-to-date spending on wages, like base wages. I asked about overtime, but there hasn't been a lot of overtime so far. And
Yeah, there was $800 or something.
yeah, so it's a minor amount. And so I looked at that, and in the wages, if there was nothing but 40-hour weeks, for that budget, we would have a small surplus of $7,800, because I was like, what's there? So all that to say, the $7,800 doesn't cover the hole in the health insurance line item, but that doesn't mean it has to be done that way. It
But
just
it helps a lot, right?
it may, depending on that, or we might use that to supplement salaries or make any salary changes, right? The other thing that I did, which is something that I did last year as well, was we now have the Vermont League of Cities and Towns compensation and benefit summary. So I went through that, and I put down what the hourly rates were for towns in our area for people who would be equivalent to the highway supervisor, or equivalent to mechanic, which there are not as many jobs that have that level. And then for highway full-time crew, I put a couple in here that were part-time, but not very many. And the net result of that, to just kind of talk about salaries at a generic level, is we are really close to being at the average for those positions. It's not perfect math, but it just gives me comfort to say we are not underpaying or overpaying to any great extent. So
I think we're slightly over average overall on that.
yeah, there's again, based on positions, but like the statewide average of the road crews is, and the average of the local thing are again, like within a penny of each other. So I was just trying to make sure that we didn't have, any super big market wage adjustment to do. So that kind of, again, I tend to go high level and then try to drill into stuff. So that just gives us a sense of like, here's what we have. We have an expected deficit. We know that the health insurance premiums overall are going up. We have several plans that we can look at and do a little bit deeper dive into. But we are really here to talk about what are the needs, what are the costs, what are the options. I don't know. I didn't sort of come here tonight thinking we would make a definitive decision on which plan to go with, but maybe we will. I don't know.
So what we're looking at is Blue Cross Blue Shield, MVP, anything else?
Those are the only two insurance providers for small group
Okay.
in the state.
That's what I thought. I just wanted to make sure there wasn't something else that we didn't
Yeah.
have paperwork on.
So,
Defense just came back.
Oh,
yeah, I can,
Do you know whether Blue Cross Blue Shield is staying in the state of Vermont?
Oh, yeah, they are.
26.
Well, what they're not doing, at least it's what I've been informed, is they're not doing the Medicare Advantage plan.
Hmm.
yeah,
If you have Medigap, like if you have Advantage, like it could be Blue Cross Blue Shield Advantage, it could be United Health, Aetna, right? It could be any of those Advantage plans. You get dental and vision. That's the plan that they're not doing.
right.
And a lot of states are stopping that Advantage plan, but the Blue Cross Blue Shield Medigap Blue, they are continuing to do. That one doesn't have dental and vision, but in some ways it can be better than Advantage in that it has to do whatever Medicare says. So if you have a procedure, there's no thinking. Whereas with the Advantage plans, Medicare could say, yeah, go ahead and do it. And Advantage could say, yeah, no, you don't get that heart surgery.
okay, and I wanna just
So,
make,
but that's what the difference, well, I'm just explaining, that's what the difference is between the plans and
But Medigap is
this is-
in regards to Medicare.
yeah,
Medicare,
this is-
yes.
This is not appropriate
Yes.
for.
Well, no, but it is for some. He asked a question, so I want to be clear.
Because some of the articles I've been reading.
Yeah.
Blue
Yeah.
Cross Blue
That's-
Shield is so close to being bankrupt.
They're hurting
That's-
bad.
They are.
That's what I wanted to get to.
That's a
Your
different thing.
concern is like the solvency of Blue Cross Blue
Yeah,
Shield.
that's a different thing.
And
There's not an answer for that.
yeah, I have,
Because they could be pulling out, is what
They-
I'm reading.
and I was like, yeah, so I wrote down solvency issues with Blue Cross Blue Shield, who bears this risk, right? The other thing that I thought though was, how is there any way to determine the financial health of MVP? I don't know
Mm.
much about MVP at all, right? I don't.
You don't ever hear about the
Yeah,
financial issues.
It's smaller and it's like, maybe they're fine. Yeah,
Pardon?
We had Cigna one other time.
okay, yep, and they're not.
They're not.
market at this
They're-
point,
yeah.
Okay, so that's just it, I'm acknowledging it, and I can't fix it.
The only thing I know about,
Yeah.
the only time I looked into the solvency beyond what we see in the newspapers about Blue Cross Blue Shield Vermont was that it was acquired a year or two ago by Blue Cross Blue Shield Wisconsin.
Hmm.
So I think, so,
Yeah.
I don't know whether that's a good thing or a bad thing,
Yeah,
from a corporate perspective, but I think there's also that
Yeah.
odd relationship, so they've been trying to sort themselves out for a while.
yeah, and then, some of the other kind of foundational questions, where do we search for doctors in MVP? I know that there was a statement made at the last meeting about our MVP doctors. Do you know the answer to
So I
this? Sarah?
tried to search online
Okay,
and then I tried to call. Cannot find out if your provider is covered under MVP until you actually have a policy number.
Us.
So they can't.
Oh,
give
that's
you
insane.
anything. Yeah.
that's crazy.
So is that, but Does VLs, so who is is Blue Cross Blue Shield, the Vermont state municipal? Like Vermont ought to be able to say, grab these guys by the scruff of the neck and say, just tell us. We've got
Um,
municipal families all across the state.
So the way that this is working now is we are contracting directly with Blue Cross Blue Shield. So when I went to VLCT and said, can you help me? What plan do I even start looking for? This was a couple of months ago. They're like, you are contracted directly with them. And that would be the case if we were contracted with MVP as well.
You're the only two
So-
companies doing business in
Yeah.
Vermont.
So, I mean, I don't know that.
Is that what all the other towns do? Like,
Yeah.
everybody,
One or the
so,
other.
VLCT
so if
does
you're
not.
Brattleboro or you're,
VLCT
whoever.
does not offer insurance. Like we get our property insurance
Right.
from them, but they do not offer health insurance.
okay, but every single community
Well-
contracts directly, what the state doesn't have a preferred provider
No.
network or anything like
No,
that.
the state has,
They have standard recommended plans.
yeah, who's the body that kind of came up with stuff? There is a body that Vermont Cares Board, I think. They are, the body that regulates the insurers. And, they were the ones who, when Blue Cross and Blue Shield and MVP came in and said, well, we want to have 11% rate increases, they were able to come back and say, no, you can't. You're gonna have, this is how much you can do. And then the insurers can parse out the individual plans to, this one now is a bigger increase than the others. But the Vermont Cares Board has already done some of the negotiation to keep these prices lower than they were.
I got a message.
So regarding the
No.
question, that was brought up last week, and I think it was Mike. Anyway, it was about the fact that, well, actually, I'm just gonna read the email that I sent to MVP. Let's see, opening parts, I spoke with you back in June and the rates were not available. Anyway, we've been looking into switching from Blue Cross Blue Shield of Vermont to MVP as premiums have been increasing drastically. A neighboring town is also looking into it, and we heard at our last select board meeting that MVP does not pay for out-of-state doctors or medical visits. This, if true, is a major concern, as where we are in southern Vermont, most hospitals and many doctors are in the states of New Hampshire, Massachusetts, and New York, which are in close proximity to us. I am looking for confirmation that MVP does cover all doctor, hospital, and emergency visits in and out of state. It is also extremely important that the insured be able to keep the doctors and specialists that they may already have. We are looking for assurance that MVP would have the same plans, the same coverage, and cover all medical visits in state and out. You can respond directly, blah, blah, or call. Anyway, I also tried calling, and if anybody tried calling an insurance company or anything like that, I was on hold for quite some time and eventually ran out of time before I got to talk to somebody. But they did respond. The email is kind of generic, but let me just read what it says. Good morning. All Vermont plans have a national, and you mentioned Cigna before. So MVP also uses Cigna as some additional
When
stuff.
you go out of state,
Right.
it's no longer MVP, they bounce off the Sigma, yes.
Exactly.
Oh,
So,
that's the out-of-state provider?
so what it says is all Vermont plans have a national Cigna network. So when a member is out of the MVP service area, they can be seen with any Cigna provider. There are thousands of providers throughout the United States. If you have any additional questions, give us a call. Yeah, I tried. Anyway. And, I will hopefully try more, but I just ran out of time this week, so.
So if you see a doctor, physician, hospital, and they accept Cigna, it's the straight, and it's the same pricing that we would have if it was a New York, Vermont.
It sounds it, yeah, it's
doctor.
it
So it's
basically,
just whether you're in San Francisco, which is an expensive market, or you're,
right.
in Halifax, you're gonna get the same pricing.
I believe it's what it sounds like from that
But,
email.
but 1,000 doctors is not very many doctors.
It says
Thousands.
it says thousands.
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 Yeah.
Because
They're not.
if something were to happen, say you end up in the local emergency room in Brattleboro or Bennington, they're gonna urge you to either go to Dartmouth or Albany. Like, they're not gonna recommend, oh, let's drive all the way to Burlington so you can stay in the state, like, so there is legitimate concerns about state boundaries here.
Well,
Right,
I guess how I can answer that real easy. My wife went through cancer. She had to go to Keene.
Yeah.
That's how much we owed when we had Blue Cross Blue Shield.
And I've always
Yeah.
liked Blue Cross Blue Shield, just
I'm not
separately.
hoping, but
Right.
when you start talking about Cigna, which we had before,
yeah,
And that was a different style of plan too. That was
Yeah,
when we put you guys on,
stay,
on the high deductible.
that
Yeah,
was-
yeah.
Yeah.
So I mean, one of the other things about Blue Cross Blue Shield in the comparison that I did between the two plans, and again, this would be something worth following up with MVP. But on the Blue Cross sheet, what it says is in the, in the fine print that you can do a health there's an email or a URL to contact about a health reimbursement account. It's not a health savings plan. It's something you can use to put money in and pay for deductibles or other things out of it. And it sounded like they had a mechanism to allow you to tap into that. So I have a flexible spending account at work. I can put my own money in it and then it's pre-tax and then I can use it to pay my co-pays or whatever else I have. In my, in my fantasy world here, I would prefer to pay less money to insurers and pay more money to employees. And I just, like, I'm struggling because I'm not sure how we might make that happen, but finding out about that health reimbursement account.
HSA/HSA. so-
Yeah, so the HRA, I think, is the piece. The health savings account is when you have to have the high deductible thing going on. So just, again, one of the other, like, this is complicated. I wish it were less complicated, but it is complicated. And, so that, I mean, again, I also wrote down that it would be useful for us to document what other towns have done. And I read in the Deerfield Valley News, but I don't have the quote, the specific quote, was that Dover stuck with their status quo, which I believe is a platinum plan. And I don't know that they have any payouts. And they had the same conversation, like, do we do this? Do we try to absorb this cost again? And for the platinum plan, for the pieces of it that I analyzed, and I was missing one piece of data, those plans increased 5.11%, just awfully close to that 5% that we thought we were gonna have, outside of the fact that we have different land levels to deal with. So, yeah, that's what I did. Now, I'm happy to share my screen and show the plan comparison that I did. Just
The
so-
only other, if I could just sort of
Yeah.
ask a question more about MVP, and I don't know if we have this answer. So how long has MVP been around with towns? The reason I'm asking that question
Mhm.
is when you have any of us has a difficult or awkward sort of medical situation and we have to call the company, right? Blue Cross Blue Shield, anytime I've had to do that, the Blue Cross Blue Shield people have been fabulous. Fabulous. Call back. They'll say, I'll call you, I don't have the answer. My supervisor will call you tomorrow. Well, if somebody else tells me that, I'm like, oh my God, I gotta call them 5 times. And then Blue Cross Blue Shield supervisor always does call. So I think that is also a soft component to choices, but
Mhm.
but I know I've used Cigna, I've used United Health, I've used Aetna, we use all of them, and they were all really hard to deal with when stuff was difficult on a personal level.
Thanks for letting me know, because I have to go from Blue Cross to Aetna myself this coming year.
It's hard. I mean,
Whatever.
well, it's different because it's I don't know, it's
Anyway.
different.
Yeah,
It's just a different,
I mean, I've always
True.
had Blue Cross and Blue Shield, and when I had cancer, same thing, it was just. So, they were so great to deal with,
they're
they're
so
just. a
personable and
different
friendly
category,
and, yeah, first name basis and it's just. When stuff is going wrong, it helps, I think.
okay. So I will share the just kind of numeric comparison here. that I did, and I didn't, again, there's so many choices and there's so many, permutations. That can be difficult to outline stuff, and I think the first problem I had is that the Blue Cross Blue Shield stuff went across the page this way, and the MVP stuff
Yes,
went
I-
that way.
same
I'm
thing.
like,
Sheets are different.
I can't stand it. So I stuck with the way that Blue Cross did it, and I'm saying share. No, I gotta say share on that button. Okay. Okay. Let's see if we can make it readable for those of us with older eyes too. All right. So the way that this was laid out, we have on the top here, the Blue Cross, plans, the platinum plan and the next plan down, which is a gold plan. And this is where I mentioned that they have a health, HRA and not an HSA for those two. So that's that first column of health spending accounts. And
What's an
within,
HRA again?
health reimbursement account.
Reimbursement, okay.
Yeah, and again, like that's gonna be an administrative thing that we have to work through Patty, like how do we?
And
How do
if even Nemrick even can do that. Nemrick, I think.
Exactly,
know.
yeah, yeah. I mean, yeah, that's a great follow-up question, and I had that in my head before, so thank you for getting that out of my head. So the next thing that we have, and Randy rightly said that these, that the platinum plan, the standard plan got the same, information. It's got the same, benefits. So the deductible, so this next section is looking at the medical stuff. And, the deductible for the platinum plan is 500, and it's $100 if it's a family or there's, if there's two. So it's either 500 or it's 1,000. And if we go down here to what we have with the MVP plan, this one, it's 500 and 1,000. So I did find that there was, it's a standard plan, and oh my God, it's standard. That's unusual. Then, so that's money that you have to put in upfront up to that amount, and then they start paying more, right? So that first lab appointment I have every year, I'm like, oh my God, that's a lot of money for that lab work. And it's because my deductible hasn't been filled yet. So the next piece of this is that there is a out-of-pocket maximum. So that is when you have those years that you really are having the close encounter with the medical community that you didn't ever want to have. And everything's like, stacked up, and you've got labs and you've got treatments and you've got everything else going on. So the out-of-pocket maximum for the Blue Cross Blue Shield Platinum plan is $1,600 for an individual. And if you have more than one person on your plan, it doubles. So it's 3,200. And that's exactly what we have down here at the bottom with the MVP plan as well.
Mm.
All right.
So it doubles if it's one person or a family
Or
or
a family,
whatever.
yep.
So it's just,
Yep. Yep. So that's that number can be a comforting factor. Because, if you have that much held back, you feel a little bit better about how this all works out. Then there's medical cost share information from Blue Cross Blue Shield. Your primary care, your mental health, your substance abuse health is $0 for your cost share. So when you go into the doctor, you don't have to pay anything. And you get 3 specialist visits if you have heart disease or diabetes at no cost with Blue Cross and Blue Shield. And then after those 3 visits, it's $15. For MVP, they did not state anything in that column. So I did, like, there was not a complete column to column agreement, but it was again very close. And if you go to any other specialist besides primary care, mental health, or substance abuse, other specialist visits are $30 per visit. Your urgent care, and this is all, I'm assuming, I don't know whether this is the same as this year. This was all from next year's sheet. So, so whether that's an uptick from last year, maybe last year was 25, I don't know. But if you have to go to urgent care, you go for $40. If you are going to the emergency room, you have to pay your deductible first. Then after that, the next one is only $100. Only $100. And then if you have outpatient or inpatient hospital care, you have to spend that deductible money and then you pay 10% as your cost share. There was information on the MVP sheet about pediatric dental vision and that wasn't on the Blue Cross data, but it did, there was again a little asterisk on the bottom. It says, okay, yeah, basically it said it was available, right? If you have the data, then we can compare it with what we have for these guys.
Yeah, we don't have vision now.
Neither, obviously.
Okay, great,
We're down.
great, thank
Me
you.
neither, obviously.
All right, so pediatric
Me either.
dental,
I don't either.
What?
um,
I don't have a screen now. No.
yeah, interesting. All right, dental and pediatric, class 1, whatever that means, is no charge. Class 2 is deductible, and then 30%, actually, class 2 is 30%. Although this one says deductible, then 30% co-insurance, class 3 deductible, 50% co-insurance. So you can see that it kind of aligns with this base thing that's MVP. This last column, or the last row is MVP. And then for hearing aids, those I think said they would be covered as well. All the good stuff, right?
Yeah.
Thank you.
Hearing aids are expensive if you need them, that's for sure.
Mm.
Yeah, and a blessing to your spouse if you need them and use them. Nobody let him listen to the recording. Yes, thank you. All right, so, prescriptions is the next section, pharmacy stuff.
That's a big one.
That's a big one. It can be a big one. Some people are fortunate. I have a friend who's like, I have to have a medication every day. I'm like, get over it. I've been doing that since I'm 16, right? Like, anyway, so pharmacy deductible, and the deductible, it's 2 times for family, but 2 times 0 is still 0. So there's no deductibles with the pharmacy plans. And your out-of-pocket maximum is 1,600, twice that for 2 people. So 16 and 3,200. Your cost shares depends on whether you've got a generic drug or a preferred drug or a non-preferred drug. $10 for generic, $50 for preferred, and 50% for the non-preferred. And that again, aligns with, in a slightly different column here, the same thing, same exact thing from MVP. So there's that. Okay, so we got that. That's the part of like what kinds of care costs you as an employee would have. This next part is about what does the town, what do we have to pay in to get those benefits?
Before
Yeah.
we do that, so are there any meaningful differences between what we just went through between MVP and Blue Cross Blue Shield? It seems like they're
It seems
spot
like
on
this,
with
it
each other.
seems like the standard plan and that oversight by the Green Mountain Care Board is.
spot on. That's what I thought, but I just wanted, there's no, okay.
Yeah, yeah. And then, so then actually, maybe before we even do that, let me also say that the other thing I put in here was the gold plan for the Blue Cross Blue Shield. And here we can see that if we go to that lower tier plan in terms of what services are covered without it being an employee expense, is the deductible is $1,000 more for a single person, and so it's gonna be 1,500. And so I did not do the same thing for the MVP with that. I just was like, here's the gold Blue Cross Blue Shield, if there's a reason to stay with that.
And the out of pocket is massively different.
Out of pocket is massively different, so it's $5,700. So,
Deductible for outpatient is 30%.
yep,
Yeah,
So-
that's massive.
yeah, so you guys are seeing across the board that this shifts costs from the employer to the employees. So all that said, again, I don't have an answer for any of this. But I tried to collect the data so that we can try to talk about it. Right, so then let's go into the cost to the town perspective, which is the 2025 monthly premiums. I didn't have with me the employee and kids from last year, and since we didn't have anybody on that plan, I kind of didn't care. But last year, the employee only was $1337.50. The 2026 monthly premiums are going to be $1409.43. The 2-person, and I don't think we have any employee onlys. The 2-person is up from $2674 to $2818. I'm not gonna round up, and I should.
Would it be appropriate now to, if anybody wants to tell us which plan, like,
Yeah.
what are you on? Like,
Or what
Let me
are you
just
gonna be
add-
on? What are you gonna be
yeah,
on? from
so
council?
Keith, what plan do you have? I'm assuming you have a
Family.
couple plan, correct?
Yeah.
What else?
Yeah, okay. Is it okay if we ask this? Is everybody
No,
comfortable
you
with?
should.
Okay, I mean,
Well,
we
yeah.
kind of know, but.
We don't
have
wanna
a
make
couple questions,
assumptions.
so.
Yeah, so it's individual plus spouse, right?
Both.
Yeah.
On the same plan,
Yeah,
sure.
so employee spouse.
Right.
What about you, Travis? What's your plan?
Same.
So employee spouse?
Yep.
Okay,
Mine's
Mike?
up in the air right at the moment.
okay,
Mine's the same.
okay.
Okay.
Employee spouse
Yeah.
also,
And yours is family, right?
It's family, okay.
Okay.
I'm sorry, whose family? We have
Ben.
Ben has a family, okay,
Yeah.
so that's one.
You have family?
And
Is your kids? No?
No, they have different insurance.
Oh, cool. Oh, that's kind of weird.
okay,
That's
okay.
That's
Alright.
cool.
So, and Wade, so you said there might be a potential change for yours. Okay, all right, thank you for letting us know that. It may help.
Yeah, then keep us posted.
Yeah, yeah. Okay. All right, so yes, and so the monthly premiums are increasing for all of these, obviously. And then I put in what it would be for the Blue Cross Blue Shield Gold plan, which is slightly less than the MVP across the board. And I am mean slightly, sometimes it's just $12 or something.
Why do I have different numbers?
That is a good question, because I
Oh, I know why, wait. a minute. So individual plus spouse for Platinum Blue Cross Blue Shield, it is 3,159.44.
Which one?
Individual plus spouse
For platinum,
for Platinum.
it's 281886.
Is your small, the one you have?
Mine is the
small-
2026.
Is it small group?
I don't know.
can I look at that one?
Yeah.
I printed it off the web, but it's,
So that's the one that got sent to my house. So maybe
So that's.
maybe we got a different one. That's just people?
Yeah.
Oh, all right. So let me throw that out then. That's not gonna
let's
help
not use
anybody.
that.
That's not gonna help anybody. Oh, yeah.
Cause it should be for, like,
Okay.
let's just say, individual, employee only is
It's okay, you can take it back.
1409.43.
Yeah, okay.
How much is it again, Randy?
Individual only,
Yeah.
that's the platinum is 1409.43, right? That's what you have, yeah. And yeah, your numbers are correct.
And how much is employee plus spouse now that I've got
281886.
2818? Okay, and what's family?
3960.50.
3,960,
3000.
3,960.50, and, okay,
So when I calculated the monthly change between 2025 and 2026 for the platinum plan, for just a single. Why does that say 2-person? Is that? Oh, because we didn't have any singles. Okay, for a 2-person plan is an additional $144.16. And again, it's a 5%, 5.11% increase. Family is the same. And then the monthly expected costs here. This does not match exactly with Randy's numbers that he said last time. I was basing it on the current configuration of plans So that if there is a change, somebody adding or somebody being taken off of a insurance plan, then this number could obviously change.
And are we looking at that full year 196? I'm just thinking, but
That
it's
is-
really just the,
That is,
because
so that
that's the
is,
calendar annual.
this is the
Right,
calendar
right.
annual, and so we have kind of two things happening here.
Okay.
One is, we need to select an insurance plan for our employees for the coming calendar year. That number will then be, this number expected annual costs will then become divided by 2,
Mhm.
and then we will put an adder on that.
Mhm.
When we do the budget process, but right now, this is really about like, what are we looking at for this important offering that we have for our employees? So, kind of getting back to that, bottom line question, that if we were to go with the gold plan, the cost to the town would be this amount based on current configurations, 167, 075, and 52. And it would be 169, 585, 44 if we were to switch to the MVP Platinum plans, which would have nominally, I think, I think the trade-off we're talking about here is same benefits to you,
You see that?
reduced choice, right?
Yeah, yeah.
I think
Nope, I
that,
don't know. I'm sorry, so for the budget, we had just big picture budget,
Yep,
and
yep.
granted, it's half of one, half of the other.
Yeah.
But the budget was 174, 692. What was the 196
that
Was
is.
for the
so
full year
that is-
calendar?
That is a calendar year,
Right.
monthly cost,
Right.
annual cost for Blue Cross Blue Shield plan.
Okay,
So
right,
this is-
that's what I
this is the
figured,
data
okay.
from last year, and
Okay.
my calculations where I talked you through this, but I didn't show this last
Yeah,
time.
and so, and I'm sorry, but the number was what, the full year was, I'm sorry, 196.
I
didn't write it down fast enough.
196, 530.
There it is,
Where's it?
530, 96.
196, 530.
Yeah,
Okay,
all right, and you guys know not to hold me to the pennies. But with the spreadsheet, hopefully, and I'm glad to understand the discrepancy we have there.
And again, that number is what we're using for what we understood to be what each person was using for,
Yeah.
whether it be family or
Yeah.
employee spouse, and that may
Yeah.
be different a little bit.
It might change, yeah. So that's all the numbers. Talk to me, guys.
Just scared about the state line thing.
I hear you.
Like,
I
if
hear
you end
you.
up in an emergency room, they can't help you. They're gonna ship you somewhere else. And
Yeah,
it's not gonna be Burlington.
yeah, yep, and that's like a really scary time, and like, do understand that the emergency room, it's an emergency, and but where it gets so tricky is they're like, okay, like, let's make up something that's bad, but not maybe super bad, like you need your gallbladder out or something, and it's like, okay, now you have to say, and all right, I'm gonna just share, like, when I, maybe oversharing, but like when I was in trying to get a colonoscopy last year, I kept saying, what's your doctor, who's doing this today? That's stressful.
Cause
Because
they all share the same office, but different doctors take
Yeah.
different insurances, and
Yes.
if you don't ask,
Yeah.
they're not gonna tell you, and it just,
yeah, I
then
know.
it's too late.
Yeah, and so again, it puts a emotional burden on people. Because again, it's when you're dealing with health issues is when you just wanna go see, I just wanna go see Dr. Tobit's.
But is there any way you can talk to Vermont Health Connect? And say, hey, this is a policy we got, this is the one we're interested in, but we're worried about out of state.
Yeah,
What's the options there?
yeah, I mean, I think the fact that Randy reached out and asked the provider if they could give more information.
but that was MVP.
That was
That was
MVP,
MVP.
But I
yeah,
think
not-
from
oh,
Keith's
health
perspective, and in the, at the
Yep.
bottom, at least on mine, but on that one, in the footnote, it says because the silver plan, if you look across, the silver plan costs more on the chart than the gold plan. And part of that has to do with Vermont Health Connect, and to call them and they'll talk through plans. So that is an option. They, you know, they have a lot of information, those guys are great, they have a lot of information. And they may know, because if they're gonna talk through,
yeah, I mean, I think where it gets to be, again, it gets to just be so frustrating, is like. We can't predict what we're gonna need in the coming year, you know, and again.
And this is the other one that I would be very interested in. Is when you said Wisconsin bought Vermont.
well, I think that's my recollection from 2 years ago,
So
so.
I would like to go back and go call Wisconsin. And see what their policies are for their employees for the same package. And see if Vermont's getting pork or Wisconsin.
Well, I did read something recently that we have like the highest.
We do.
premiums.
Oh, okay, Vermont is in the whole country,
Yeah.
so they definitely have less than we do.
They should put us on it with Wisconsin.
Cause then the
They
people
bought
in-
Because then the Wisconsin gotta pay for us.
And then people in Blue Cross Blue Shield don't make the money that they make as an insurance.
Right.
Sadly.
Well, and that's all the whole, how people, how hospitals and are financed.
invested in it all,
Like,
thank
I'm
God.
hoping we don't lose our hospitals.
Right,
I mean,
yeah,
I'm hoping we
exactly.
don't lose the
Actually, yeah,
hospitals that we got.
Hospitals are struggling.
They're,
Well, I
Yeah.
can tell you too, even with the statistics you put up here and what things cost. I mean, you know, Mike and I have had a rough year with surgeries and health. I mean, we've
Yeah.
paid out a lot more out of pocket than what those things say,
Yeah, interesting.
you know, so.
Yeah.
because
I don't know, but I've paid over $5,000 out of pocket for me alone.
I'm guessing it's because probably some doctors or specialists were not fully covered or
Right.
Blue Cross wasn't fully covered.
yeah, Blue Cross Blue Shield pretty much
And I was in
covers
Dartmouth
almost
and
everybody.
Grace
They,
got-
they don't cover every doctor.
No, they don't.
They're
No.
still doctors. Matter of fact, we had a doctor we were going to about like 5 or 6 years ago. Steph had the platinum plan through the school. And the doctor, they said they would no longer cover that doctor. So there was another doctor in the same office that they would cover. So we went to that doctor, didn't like the doctor. We had to find another office, another doctor altogether. So every insurance company does and can change, drop, add
Yeah.
doctors at any time they want to. Unfortunately, that's the
Yeah.
insurance game is a mess. It really is.
Yeah. And.
Yeah,
so-
Wisconsin is anthem. But anyway, we're gonna be different.
Okay,
They've got stuff on, okay.
Well, we're getting close to 7.
When we looked at, and I just did sort of very quickly, and Edie, you talked about the line being platinum in the cost and then underneath the gold. And
Mhm.
again, I'm talking Blue Cross Blue Shield.
yeah,
And when I looked at it, it was massively different. As far as how much higher out of pockets and things
Yep.
were.
Yeah.
The cost savings.
Yeah.
For that is way out of line in that it's like a couple $100 cost save versus what somebody may have to go through with humongous out of pockets and humongous stuff. So it's just, to me, going with gold is just kind of, it's like
well,
it's kind of like a false comparison, because if you have to pay a shit ton more, pardon my French, the reduction should be much higher, and it
So the-
doesn't seem to be.
so the reduction here between the platinum and the gold is what, 30,000 roughly?
Approximately.
Okay, so it's about $30,000. So then our question, you know, my question to the board is, if we do something like that, do we then figure out, like, okay, we're gonna instead take our wages line and try to offset some of that cost, right? And whether we can do it through that health reimbursement account or some other mechanism.
If this, and this is kind of where my head is at, and so
Yep.
correct me and redirect me. If the difference all in based on our population is $30,000 difference between gold and platinum.
Yeah.
Okay. A single family that has a catastrophic illness could be out of pocket $30,000 real quick, all by themselves. To me, that's a risk I think we need to include in our arithmetic, because if a family's gonna be out of pocket 15 grand, you got two families out of pocket 15 grand. So that,
It's,
that's the math that
yeah,
I'm not,
yeah,
I can't jive in my head, that I
but-
don't want anybody to have to face that kind of out of pocket and
Right.
that kind of.
and to be a little bit clearer, it would be 5,700 and it would be twice that. So for 11,400 is the maximum out of pocket, according to this piece of paper.
But then it says deductible for outpatient and inpatient hospital services.
Right.
Deductible then 30%.
The 30%, I mean, if it's
Yeah,
a
yeah.
catastrophic situation and somebody's in ICU for a week or so, God
Yeah.
forbid.
I,
That family has to come up with 30 grand.
No, you don't make payments.
Oh, geez.
well, this is why there are so many people in the US who have medical debt.
Right,
Because it's just, the system is
Doesn't
convoluted.
work.
Another word I'm not gonna use right now, convoluted, and two, it's very, very complex, and so it's hard, it's hard for us to make decisions on these issues. And, again, I think that I would like to give less money to the insurance companies and more money to employees. But what that does is it does still push some risk to the employees, I think, right? Because if you have a good year, you might be fine, but if you don't have a good year, it's.
yeah,
really a challenge.
my risk appetite when it comes to healthcare is very low, this is me personally.
Yep,
Our crew has dangerous jobs,
I agree.
as opposed to, me sitting at a desk.
Yeah.
So, for me, the risk of a family having to face a catastrophic cost, we've got a gold plan versus a platinum plan, is a risk I wouldn't take that risk for myself.
And then, my employer didn't ask me my perspective on the, what their insurance plan was gonna be like this year, but all that to say, right? Then the question becomes, if we say we're only gonna look at the platinum plans and we're not gonna look at that other level, then the question is, do we go forward with some questions about MVP and the network of providers that is really within reach for our staff? I mean, like, I can tell you it's not a lot of fun, and many of you know that too, just trying to get up to Lebanon when something's wrong, right? It's a long drive. And so again, but that's in New Hampshire, so. All that to say.
That's where they send you, because that's where the good doctors are.
It is, yeah.
It's worth it
Oh,
to go there.
I am 100%
Save your
convinced,
life,
yeah,
worth it.
right, so, and I mean, this is the other problem with.
No,
But you're saying,
Insurance
but
in
that's Blue
general.
Cross Blue Shield ships you out there. Who is sending people to Lebanon?
When you go to Brattleboro and.
Our community sends you up there, our local hospital.
And
I-
the hospital will ask you, are you going to Albany or are you going to Dartmouth?
Yeah.
Like,
Yeah,
that's
Right,
what they
just-
yeah.
They don't do certain.
They don't care about your insurance. They're gonna send you somewhere whether your insurance pays or not. Like,
yeah,
it's beyond their grasp of care.
no choice.
Yeah, so it's, that's, I think, to me, that seems like that's the foundational challenge here is. Reduced choice, potentially. And. But less out of pocket, right, more similar to what you have today. And sticking with the platinum plan at a cost that. I have to say, I should start off by saying. Last year, we submitted a budget. And it was unanimously approved. There was nobody on the floor who said the budget was out of line. And I mean, I think that's because we spend some of this time really talking through what is it that we value as a community and what is it that we need. And we don't, we absolutely need to look at this issue. I want people to be able to kind of go forward with whatever it is. And, again, and this is just, we're looking at a societal problem And, so nobody's getting away with no pain this year. But how do we wanna do that? And again, do we as a board think we have enough information to make a decision about which plan, tonight? Or is there some
No, I
key
don't
piece of
think so.
information that we're
What
missing?
I mean,
What are we missing?
I think I do, but that's because I'm just looking at my own risk profile and how I would look at things. I don't know what you all think, but, you know, Rhonda, Randy, Lori, Edie, if, you know, if you need particular information, then we should figure out what that is and who's, you know, who's gonna
Yeah.
get it.
Cause there a way you can find out if everybody that on these insurances, that their doctors are in these networks? I mean,
I think.
how do you do that?
I think the
mean,
answer is,
Yes, the answer is no, so you run the risk.
yeah,
that's so stupid, you know? That's so
You
stupid.
can't search online providers in my area, you can't.
Oh my God. Oh, can I listen to some- now we're gonna have some music.
no,
You call and your doctor says, oh, some
was
of
my
us
fault.
take MVP plans, but we can't tell you if your plan covers it.
Oh.
That's,
Yeah, cause that's what I did. I ended up when I called all my doctors and said, do you take?
The MVP Platinum plan would cover, if it's gonna be covered by MVP,
Yeah.
the Platinum plan would do it for sure. Because it is
Yeah.
their top of the line plan that is on par with,
right,
you know, Blue Cross.
right.
So
It seems
you
like there
said
should
if
be
you
a way.
called your doctors, they would tell you that certain doctors are covered by MVP?
But they want to know your plan information, and we didn't know which
Right.
plan we're going towards.
Well, I mean, I think if we were going to MVP, we'd be probably looking at the Platinum plan.
Yeah,
Yeah, I can't
I mean, I
imagine,
would guess.
right, the others wouldn't make any sense.
Yeah.
For the same reason, looking at anything but Platinum and Blue Cross Blue Shield doesn't make sense.
correct. Yeah. So I heard one person say that you would be ready to make a decision tonight.
I mean,
And I mean,
again, my risk profile is different, not knowing doctors, if you have a specialist and that specialist isn't covered. You may have one specialist, I mean, that's for the families to
well,
to give
I
us
guess,
guidance on.
yeah, I mean, it is, and ultimately the decision about which plan to choose is on the board.
Oh, I understand, but
Yeah,
I'm
okay,
guided by the families.
okay, yes, then go
I
ahead.
just wanna add, I
Yeah.
do like what you said, Karen, and I agree with it. It does scare me a little to go to MVP, you know, cheaper isn't always better, and I understand that, you know, it would help the town, but it's kind of,
The
unknown the unknown is very scary.
Do we know
Very
what the
daunting
cost
as a-
differential is, platinum to platinum for our families?
Yeah.
What's the cost? Let me just, maybe,
It's 30,000.
I mean,
oh, that was the 30,000, okay,
That's 30,000.
you know, shoot,
That's the
we
30,000.
could find $30,000 in the gravel budget and that.
You know, the issue is like every year, the insurance just keeps creeping. We know,
And
I
it's
mean,
gonna.
this has been an issue.
Yeah.
And last year, we talked about this and there was some debate. And we finally voted to do to pass what we have now.
Mhm.
And then the very next meeting, we were like, oh my, what are we gonna do? What it said, one of us said that, something, we need to do something, we need to make cuts on insurance. Because
Mm.
insurance is,
Mm.
that was at the January 3rd meeting.
I think we also thought
We
one
knew
point that
that
it was
we were,
going up some drastic percentage.
Well,
Higher than it was. I mean, at one point it was, you know,
1 year we
20+%, and it kind of went up 5 or 10%
right,
this time in reality. I mean, I
yeah, this,
read my
yeah,
own
this
side
year
of
was a
relief
little
when I
bit
got my
easier for
numbers.
sure.
yeah, I mean, and this, yeah, so when we made the decision last year, the previous year, we had put in, budgeted an 18% increase or 15% or something
Wow.
crazy. And then it was close, it was a little bit over that, but not bad. I feel like we have the same situation this year in that we said 5% increase. That's what we've got is a 5% increase. But then with the change in employees and the plans, that's where that deficit and change happened. So,
And
I would-
another,
yeah,
I was gonna say, another hard part about this is, we have information, we have a annual year insurance number,
Yeah.
but we work on
Yeah.
a fiscal year.
Yeah.
So we don't know what's gonna happen in 6 months. So
Right,
we
we
can
always
throw a
have a
number out
6 month.
there.
Yeah.
And
Yeah,
that's where we get into, kind
Right.
of get into trouble.
and we know it's not gonna go down.
No, for sure.
Well, yeah,
So, right, so the back half, the back end, we just have to take,
we just have to estimate, again, like if we say,
Right.
and that's why, like, to some extent, right? When I said, let's go with a 5% increase this year, I was guessing it was gonna be more like 7 or 8. And then we would have had that 3% differential, and then I would be like, well, can we put 3% more in wages, like, you know,
Exactly,
try to,
yes.
try to work it out.
yeah,
At this point, I have to say, I think we could look at these numbers until we're blue in the face. We know what the risks are. The risk is, you know, fear of change and fear of coverage in particular doctors. And, you know, I know that, times are hard and that property tax issues are gonna be a concern as we go throughout the entire budget process. I'm not sure this is where I wanna cut.
But can I ask you, what are the employee benefits? You offer them health insurance, their vacation time, and you help with their retirement plan. Is that correct? Or am I missing anything?
I would say you're not missing
That's
anything.
pretty close. There's other things like the workman's comp and whatnot. Last year, I had it written down last year, I don't have it now, but last year it was around $123,000 per employee average. So
the benefit.
obviously,
the
some was less, some was more, but yeah, it was
The benefit.
just under $625,000. So that's $125 average per employee.
What-
So
I'm confused.
that's wages.
Wages plus?
Yeah.
Okay.
Oh, I thought it was just the benefit.
Like, whoa, okay.
No,
Yeah.
wages, benefits, everything, that's what it came to, so, yeah, I mean, if the insurance is obviously, pretty.
Right.
Yeah.
pretty-
If-
I mean, that's just
to-
Only thing I'm gonna say is you don't have people knocking on the door slamming to come work here. We went all last winter down the whole guy because of the train here, because of the pay, because of everything else. You start cutting more benefits. You might lose some employees, you might not, whatever, but they're not gonna come running in the door to replace them. So, I mean,
Yes. And,
it's a
you know,
gamble you guys gotta take.
Right,
that, and, you know, I think when I look at this, these numbers up here now and know that our health insurance is $174,000, $175,000, and our wages, what we're paying you guys is 340. When I look at those numbers, I'm like, that's out of whack, clearly, right? I'd rather.
It's like
There's nothing you're gonna do about it,
Exactly, that's.
unfortunately, especially when you only have two options.
Yes, yes, and you know, you know. If we do nothing. I believe that's it. I believe last year we did nothing and we continued on in the platinum plan. I don't think we had to formally make a designation.
So yes, as of, if you don't make a decision before December 31st, it'll stay exactly the same as whatever plan you have.
Yeah, I think we might have had like 30 days beyond that to make a final change, but they just roll you over, which is handy for us in terms of administrative needs. Yeah.
That was also last year, remember, we had a fluke with not having it, cause that was right in the time when I was in the ER at Bay State. We didn't have it.
We didn't have
Insurance.
cards, we didn't have anything.
Yeah, we had
Like,
nothing.
Oh, really?
So it's better to make a decision than.
Okay,
Oh,
yeah,
gosh.
well,
Yeah.
yeah,
Yeah.
It was
Yeah.
Pretty scary. for
I
me.
Oh,
think
gosh.
we went January with no cards, no policy numbers, no.
oh,
Is that
really?
because we hadn't decided? yet?
No,
Or
we
is
had
it-
decided, I thought I
We
didn't
got
have to do anything.
cancellation letters and everything.
Oh, God.
Like,
You did?
yeah, I
Yeah,
have it at home still, yeah.
I would love to see that
Yeah,
because
we
they
don't want
told, like, I was going by, you don't need to make any, if you're not making a change, you just.
yeah, cause we had made
So-
a decision,
so-
December 17th.
Yeah,
So by letting it just roll
So-
over, we assumed that it wasn't gonna be an issue, but it caused a little bit of an issue, because we didn't say
because
to
we
them a
didn't
month
like
before,
call them up
yes,
and
we wanna
say,
keep
and
this.
call them up and say we're keeping.
Yeah.
Okay, so yeah.
Well, then we should
So let's try
probably
next
do,
time.
well, that would be something I'm sure Patty would be able to do.
Yeah, but yeah, I'm sorry that it didn't happen.
Yeah, that-
I was completely
Insane.
under the impression I didn't need to do anything and it would just roll.
I don't know that it was on you yet. I don't know. It
Yeah.
would have been, I don't know.
But we got letters in the mail saying our insurance was.
Right.
Holy cow.
Okay, if that happens, please let
Yikes.
us know. Thank you. That's not what we were intending. We didn't use it before. Somebody wanna make a motion?
I'd still like to talk about, the difference as far as some sort of a contribution, some sort of a way to, stick with the platinum plan, but have a little bit of employee, contribution.
Okay.
And I don't know how, I haven't put any numbers together, but
Well, I believe you got 4 employees that are already contributing to it,
already what?
already paying.
Are your tax dollars, are you saying?
That's it.
Okay. Yeah,
So,
yeah, and,
Well, there's one thing,
but
I was told I'd never had to worry about my insurance when I started here, and I'm holding you to it,
Ben was told that too.
so.
I guess the way, where you're going with that, Randy, I understand where you're going for it. But I also, when I go through the town report, and all the money to the Give Me programs are in Brattleboro. If you can't take care of your employees or your townspeople that work here, we should be cutting all that money that goes to Brattleboro and some of them.
That is something that a lot of people agree with. But it's something that the only way that can happen is if somebody makes a motion on the floor. to
That's
change that.
that's already in your
So
town ordinance.
as far as,
Any employee or any organization that asks for money in the town of Halifax has to be present at the day of town meeting.
Yeah, but they never are.
No. So why give it to them?
I don't know. That's kind of a good point.
can
Just
you
another.
tell me where that, I'm,
yeah, I would.
Gotta be in one of your ordinances, cause it was.
Well, where is it?
Just another food for thought too, and I'm not trying to ruffle feathers and make more debate. But you expect all us employees to be on call for zero money. So now you're gonna start asking us to start paying some portion of our insurance and expect us to be on call at the mercy of Mother Nature to come in to go to work whenever for zero money, to be expected to stay home when you're not at work.
And not just.
Hey, we can't, they can't,
I wish-
what do you mean, get paid for on call?
Yeah.
Like every.
That's, no, we got too much money going on now. I mean, if you get your insurance, that's pretty cool.
I'm not saying that you need to debate it and that, I'm just saying that's another thing you gotta think of that.
Cause that's kind
I'm
of big
not saying
bucks.
that you need to pay us to be on
Yeah, no,
call.
no, yeah,
But I'm
he's just
saying,
pointing out that,
do not pay us to be on call.
Oh, I know.
Expect us to be
Correct.
here every time when I call these guys.
I don't think anybody does, but anyway,
What do you mean,
What's
does?
pay the people to be on call,
Waiting does,
do they?
that's Stanley. 4 extra hours
that's
every
it.
week.
Yeah,
I'm
find
sure,
the
I'm sure
ordinance.
Keith is right, cause he always is, I can't.
yeah, that.
What's that on there?
It's probably tucked into something that isn't a.
I feel like I've heard this too.
What would it be
Was
under?
that Caitlin, yes, go ahead, yeah.
Randy?
Yeah.
Is there a certain reason why you feel that way?
I just want to do whatever I can to like keep little things cut wherever we can.
Cause I just hope that you keep in mind that at least 4 employees are taxpayers too in this
Mhm.
town. So we understand that. But it's also the life that we live 365 days a year. I mean, when we were up in Dartmouth during my health,
Mhm.
nobody covered for him. People are texting him, people are emailing him. And I'm going through the time of my life and surgery, and he's sitting next to me, well, I can't breathe, worrying about this place. I mean, we've come here every year, but for these guys, and I've already told Mike, I'm at the point of. If this is gonna keep going and these guys are gonna keep getting bashed for the job that they do in town.
Nobody's.
And all
asking
the,
for that.
it happens, Randy.
Well, it
and
may, but
every
it's not
time we
happening
talk-
here, you know what I'm saying?
No, I'm not saying you are. That maybe it is time he goes and finds a better job. Where he's a little more respected for the work that he does. Cause I'll tell you what, it isn't just an 8-hour or a 10-hour day. It's all the time. And it's all the time for all these guys too, cause they get called in any time of the day. They got called in last weekend to go in for brush down. It's not just a winter job of plowing snow. It's all the time.
All right, thank you for expressing your concerns on that. I appreciate it. Okay, so what are we at for time?
10 after 7.
10 past. All right, so Randy, you were still hoping to do some cost shifting back to employees. What about where you are at the moment?
I mean, we're talking a $30,000 difference,
Mhm.
right? Between the plans. I feel like we're up against a wall and we don't have a lot of choice in this matter. Really, and the unknown with the MVP, whether who your doctors are, who you can find for doctors, I mean, it's an issue. I guess I would be leaning towards staying the way it is. I hate it that everything is so expensive. I mean, I pay taxes too. It kills you. But I don't know where our choice is. I don't know the little nickel and diming that we try to do, and I understand what you're trying to do. It's just, it's not gonna add up to
Yeah,
very close to what we need to make up.
No, it has to be a significant chunk, and that's when we get around to it, and we look at the needle movers, which are the,
Right.
line items that are of a certain size or have changed a certain percentage.
and this one might be.
And that's, well, yeah,
Yeah,
but,
indeed,
but,
but-
it's kind of a fixed, we call it a flexible cost, but it's really a fixed cost. We don't have, I mean, we can pick a plan and that makes it flexible, but in reality, our behavior isn't gonna change something like if we say it's flexible and we're gonna spend something else. It's kind of like we're commodity, we're like, okay, it's flexible in how much we buy, but we can't impact the pricing. But there are obviously some big places, and if we say, okay, here's our number, if our number is 30 grand, let's take 5 from that, 5 from that, 5 from that, and 5 from that, and just off the top. That's
You know,
one way of looking at it,
And I'm
so.
not sure as far as the accounting, if this is something that can happen. People are interested in buying that piece of land up the street. I don't know. That's not a lot, possibly. I don't know how much it is. Is that an offset for something like this?
Mm, Yeah.
It's like,
I'm not sure.
Kind
where
of-
that
Yeah,
might
from
go.
an accounting perspective,
I
that,
don't know,
that
that's-
wouldn't, I
Yeah.
don't believe that
Yeah.
it would work that way, and it
Okay.
wouldn't be a big enough number.
well, no, I understand,
that,
but
but-
sometimes when you're looking for money,
Sure.
and you get a little here, and you get
Yeah.
a little there, and a little here, and next thing you know, you have what you need. And I'm
Yeah.
not saying,
And that's essentially how it works, except for where we have reserve funds, where that money can only be spent there. Everything else, it's gonna be up or down, up or down, up or down. And at the end of the day, it's like we're net up or we're net down.
Right.
So that's really the only way we can do that, but we can control. Well, as we go through it, the way I'd like to at least be able to explore, okay, if we have a big ticket item, instead of buying, X tons, well, we'll buy X tons less something for the $5,000 on that. And now, we may end up having to go over, because at the end of the day, if there's something that we need,
we gotta buy it.
we gotta buy it, but at least we can start, and that in the taxes, then that just becomes a deficit that rolls forward in the next year. But that is not unusual for municipalities, that's just kind of the nature of budgeting in a municipality, because you're never gonna get it right.
Always juggling.
Right, you're never gonna get it right, and if you're within, I think, 5% up or down, you're kind of threaded the needle pretty well. If you miss by 10-20%, yes, that's terrible, but if you're up or down within 5%,
Mhm.
on a municipal level,
Yeah.
I
so
don't think that's
We're,
horrible.
yeah.
Well,
It's,
you see, one thing you did, you left for your health insurance this year, you left $6,000 on the table that you lost.
Give it back.
Oh,
What
you
do you
lost it because you didn't trade the 550 when you should have and got rid of it.
Oh, yeah, there's stuff like that, for sure,
15,000 to 9.
for sure, stuff, exactly, stuff
We're-
like that
we're gonna-
happens,
Yeah.
exactly, no, you're right.
Wow.
You're right, there's the up and down, and that's why
And-
from a health perspective, that's like, okay, that's kind of a sacred thing for me, right? This is what people rely on, and that, fine, and it's up to us as a board to be more efficient. Like you said, not having situations like that not happen. I'm sure there was a bunch of reasons for it, but that's what happened.
There's,
And then just figure out,
there's
and maybe we, instead of having a
some more
triple A.
money left on the table, but I will leave that to another time.
Yeah, we're not gonna do anything perfect, and I think, that, like the broader conversation about what how do we wanna deal with the circumstances we're facing today? we can't change the past. We, we might be able to try to influence the future in some ways, but not at this level, not at this local level. To try to figure out something better for American healthcare in general.
Yeah.
And all of that to say, that's not something we can solve. So how do we resolve, where we are today with this?
Do we need more information? Or not?
Well, I don't know, Ron,
we need-
what is your perspective?
I don't
What
know.
information would?
I hate insurance. Hours
love
on the
insurance,
phone.
yeah.
Hate fucking
We love
stuff.
it. and we hate
Sorry,
it, right?
I didn't mean to swear. It came out.
It's okay.
Do we need more information on this, on these two plans before we make a decision? I don't know.
See, I feel like I could have, we could take a vote tonight and I could make, I
So-
could take a vote. I don't know that getting any, like, if the thing that I'm lacking is an understanding of whether individuals preferred doctors are covering, I don't think we're gonna get that
I
answer.
feel like that's the main issue. If there is
Yeah.
anything,
That would be
that's it.
big too.
But
And that's like, we don't know if we're gonna end up with some, rare thing that needs specialists, right? So.
I don't get that, because when I called my person there to get my insurance, they told me I had to pick another one. And they told me all my doctors were in that loop,
Yeah, that's good, okay.
because that's different.
No,
Is that different?
Wh- I don't know, cause I don't know.
Oh, I had a broker, but, cause I don't get it.
Yeah, and I just wanna acknowledge that your situation today is probably different from.
Yeah, it is
everybody's.
different, yeah. Got the
and-
old folk stuff.
Yeah, yeah, I mean, healthcare is not a standard supply and demand curve. When you're in a health crisis, you will pay almost anything to save your loved one or to save yourself. Let's
Oh,
be
yeah.
real about
and it's
that.
after the fact that you're.
Yeah, and
if
after the
you're in
fact, when you're
another
like, that
catastrophe.
cost $250,000, that thing, okay, great, whatever.
That's cool.
So I think we are living in this situation. We have this, I don't know that we're ever gonna have perfect information. And if someone is willing to make a motion, we can then, debate that and see if we can get to a resolution for it tonight.
Well, I can make the motion, I'll just say that for
Here.
the level of coverages, assuming the level of coverages are the same between the two policies, if we're going platinum to platinum and they are, column to column, dot to dot. And they're a little bit cheaper, we don't know, again, when I said early on, the soft thing about the customer care that you get from Blue Cross Blue Shield. Better than anything I've ever had with any major insurance company. Since I started working in 1976. It really having to deal with Blue Cross Blue Shield is, to me, it's like it's a blessing. So I personally I think that is a benefit, a soft benefit that I think is important, especially when things are going wrong.
Okay, so do you wanna make a motion?
Yeah, okay, sure, I would like to move that the town of Halifax continue with the Blue Cross Blue Shield Vermont Platinum Plan for its employees.
Do I have a second?
I'll second it.
Okay, so a motion has been made and seconded to continue with the Vermont, or with the Blue Cross Blue Shield Platinum Plan for our employees. Any further discussion?
So we gotta come up with an extra 30,000 to cover this? Is that what you said?
When we do our budget for next year,
That's what it's gonna cost, 30,000 more?
yes.
Is that what, okay.
Yes, plus whatever adder for next year's increase, and keep in mind, we have a half a year, so the actual difference for this fiscal year is like $7,000 or $8,000 more in the hole than we were before. So it's,
Okay.
so for the current fiscal year, it's that amount, and then the rest of it goes into next year's budget, and we defend the budget if we proceed with that. And we have this conversation in that room with all the people, and if somebody asks us, I mean, I will say last year, the one thing that somebody asked us was, do you think you're paying your people enough? And I was able to say, we seem to be tracked, right? So, that it wasn't it wasn't the opposite of, again, people, I think, were appreciative of the services that our highway employees give us. And they didn't, they were with us. They said, go for it, right? We didn't have anybody, one person said anything about the budget. So
Uh-huh.
are we ready for a vote? Again, votes do not have to be unanimous. They can be what they are, right? Are we ready? Okay. All those in favor of keeping the Blue Cross Blue Shield Platinum Plan for our employees for the calendar year 2026, please say aye.
Aye.
Aye. Aye.
Staying.
Okay, you want to abstain?
Mhm.
You don't want to, all right, so any nays?
What's that mean?
If you say, no, I don't wish to stick with Blue Cross Blue Shield
Oh.
Platinum for 2026 for the employees, you can say no. Or Randy chose to abstain, which is an interesting.
That is.
I understand why you did it,
Well,
but is
I'll
there?
tell you why I did it. I did it because I wish
No,
there
no,
was a
no, I
way
understand.
to figure out
Yeah,
more about the MVP.
No, I get that part. I guess the question is, when you abstain, is there a procedural
Randy,
requirement to
I
abstain?
understand that totally.
Yeah, I don't think there's a procedural
Okay.
requirement that you, I mean, some people might, in higher levels of government, they vote present sometimes, which doesn't indicate a position
True.
necessarily.
But is there a, well, then to his point, and I know we've gone beyond the discussion point, but I mean, this is important. If there's a way that we can get in my mind, the families comfortable with a cheaper option, then yeah, we should do that. But that kind of then goes back to the families. You
Right, and it
need to
doesn't
tell
sound like
us.
We have that.
Right,
time to
you
do
guys
that
need to
or the
tell-
Ability to do that right now.
Well,
They
if you can make a few phone calls and we could have a
Yeah.
vote next week or.
I can help you.
I mean, that,
Well-
right, cause that's what, cause I understand why you're abstaining, and I don't think that's a bad choice at all. But we need the families to tell us,
Yeah.
So, yeah,
and get guidance. I know it's our choice, but
I
it's
think-
their doctors.
I think the only way that it can be done is, I think individuals have
Well,
to
exactly.
talk to their doctors and see.
Is that, can you guys do that? And then we can,
Well, I am trying to figure out, we're in the middle of a vote.
Or you
here,
can.
and-
Oh,
10:30.
yeah,
Yeah, it feels,
have,
yeah, I mean, it feels a little bit like
But it really should be
We're
done
having-
next year.
When we made the decision, because we're all nervous about MVP as it is.
and I,
okay, then that's
and
fine.
I understand that. That's why I would love to find more information,
I mean,
but
cause Sarah, you talked to them, right? And they won't give us information until you have a policy number.
Yeah.
So.
A
then if they
policy
don't
number.
do it, right.
Policy number, not just, oh, my town's thinking about plan A, plan
Have we
B.
tried that though?
And I'm gonna go back to the fact that I've got an open vote here.
Yes.
I'd like to get Rhonda's vote. Do you vote yay, nay, or abstain?
Abstain, because I think
Okay.
there should be more information. I'm
Okay,
sorry,
it's 3-0.
but it's all
it's still,
cool.
it's still possible.
I
It does
just think
yeah.
there should be
It does-
more
it does
information,
pass.
but that's okay.
And,
No, that's a fine. vote.
so I wanna
Yeah,
say, like,
okay.
again, there's little that's harder than these kinds of
Oh, these
conversations. So,
suck.
yeah. So I wanna
These
thank
really suck.
everybody on the board. And I, you know, to some level, my role as the chair is to try to give us some level of efficiency and to move forward. Always, we're gonna always have imperfect information. You know, I hope that you, you are all coming to these meetings prepared, you're thoughtful, you're looking at the issues. And you're getting, you know, you're getting input as best we can, given, again, an imperfect world. So I want to thank you.
And I
for the
think
effort
that-
you put into this.
I think that, I really thought that going with MVP would have been a lot easier because I looked at their information, looked at their numbers, everything looked the same. But it was, you know,
Yeah.
basically the same price as the gold. So it was a no-brainer, but obviously, if there's the concern over doctors, I get that, totally get that.
Mhm. Yeah.
Unfortunately, you know, we don't know.
But we can still ask our doctors.
Yeah, you still
Yeah.
can.
Next
Yeah.
year.
Yeah, that would be
Yeah.
a good thing to do.
It'd be a good thing to do.
And if you don't have a condition yet, but your family has that condition and you might get that condition, ask them. You
Right.
cover X,
Yeah.
Y, Z doc. I mean, that's what I ended up when my parents were so sick. I was like, okay, I don't have these things, but I wanna make sure
Yeah.
that So when you're talking to your doctors, you should explore that as well.
Okay.
Perfect.
Thank
All
you for
right,
your input.
thank you, everybody.
Thank you.
You're
You
welcome.
have no clue how dedicated these people are, cause my little girl wrote to Santa. I wish that he can just have her dad stay home on Christmas Day, and he told her that. That might not be possible, he goes out so everyone else can get to their families that day.
In the last couple of years, it snowed, I think, too. So hopefully,
Yeah, it did.
hopefully this year it
It's gonna
doesn't.
be hard to explain, but
Yeah.
you have very dedicated employees.
We really do.
And all 5 of them
And we
now,
do thank
now,
you.
so that's good.
Mhm. No, we really do.
They're here for you, so we appreciate that you're here for that.
Yes.
All right, folks, thank you for the conversation. All right. Let's
Okay.
move into our second,
No.
and we
I
have,
don't got long.
we've got about, we've got about half an hour to talk about budget in
Oh,
general.
but before we get off of this topic.
Yeah.
So that we don't have the cards problem. do we-
Yeah.
So what is the,
I'm gonna send a message to Patty right now, and I'm gonna send.
Ask her,
Last
yes.
year, I didn't do anything because I was told we didn't need to.
but maybe we
So-
should just say, let's affirmatively call Blue Cross Blue Shield.
Can
'cause
you
I think-
please?
Because of what happened last year.
Yeah, because of this disaster that several people had.
Blue Cross Blue Shield to say with the platinum plan.
Okay, oh. Shoot.
Yeah.
You don't get all that, I know.
I do.
Well, if we paid attention.
Okay.
My Greenwich for.
Y'all. Gonna keep it together here. Didn't have cards in January. Edie distracted during meeting. Alright.
Actually, you should ask her to send an email. I mean, she could call them, but then follow up with an email,
Yeah,
because I wanna make
definitely.
sure if somebody says,
Thank
hey,
you, everybody.
thank
Have a
you.
good night.
Thank you.
If somebody
That's
says
awesome.
something, I wanna be, say like, oh no, we had this email and we told you on November something.
Okay. All right. Thank you. Hitting send. One
Okay.
thing out of my pocket until tomorrow and I'll come back to you. All right, so let's talk about budget in general. And we left the agenda items pretty much the same they were last year. To talk about process, overview, objectives, process. And so last year I tried to push for this and it didn't
You
really
better take a piece.
happen. Yes,
There's a-
please.
there's a-
You know what, not for nothing, I'm gonna have a piece
There's other
now.
kind.
Take a whole thing out. You got, you know, yes, please.
Oh, yeah,
please do
forgot about
that.
this.
Because it's way too much.
Forgot about it.
Same thing.
So.
You wanna,
I want to talk a little bit about objectives for the budget season. And this last year we did kind of ran away from that and didn't do it. And this year, when I got, at some point, there was a newspaper in front of me that said that Brattleboro's town had said that they were looking to develop a sustainable budget. So we all come here with different perspectives, and what I want to do is to talk about what do people feel a good objective is as we're at the outset of this process. We just talked about one little piece of the budget. We're going to do this for dozens and dozens of line items. And so I'll start by just kind of sharing my objectives. For me, I would like to have a budget at the end that I feel speaks to the town becoming more resilient. And I would like to have a budget at the end that speaks to us continuing, I think, to kind of be reality-based. So my two words are reality-based and resilient. And we can think ahead about like, how might that play out? I'm not saying I want to do a zero base, no increase budget. I'm not saying I want to do a 5% cut budget or a 5%, no more than 5% gain budget. I'm sort of saying, like, for me, when we look at all of this in our financial perspective as a whole, I want to feel like we are not, like, we're better prepared to face a crisis. We're better prepared to face an ice storm. We're better prepared. I don't want to ever have to face another Irene, but I think we have to be, self-sufficient, and we have to kind of think about that resiliency piece as we craft the budget. So there are some specific things as I'm looking up here that I'm like, okay, that might be a place where I want to put more effort into this year. So did anybody else think about this? Like, why are we sitting here together besides the pizza?
I agree with you. I think we do need, if we can be resilient and we can be reality-based, I think those are two obviously important things. But I'm curious, what is a sustainable budget? How did they describe a sustainable budget?
I didn't read the article.
Does that mean they just- Okay.
I think they were looking at like a 4.5% increase, but they also have people who are coming in much earlier, in the process, like they've got department heads that come in and say, here's my budget for the recreation department or whatever, right? So they have a lot more like insider information because they have department heads who have already clued them in on like what that number would be.
The one thing that I worry about of all of this is the Branch Road Bridge.
Oh, yeah.
That is the one thing,
Big bucks.
Because it's an unknown.
because it's an unknown, and I know I am delinquent in talking to Patrick, but it's now on the board, so I will be talking to him, Brian. It's the snake has gotten into my backyard, so I will definitely talk to him. For you, Nancy. But that's the one that, everything else I think is reality based, and we cut as much as we can and we do everything, but to your point, how are we ready for a catastrophe, right? And that comes back down to what goes into whatever reserve funds. And if we get windfalls, like we got money from GMP, rather than have that go into the bigger fund, if it went into a highway capital fund of some kind, because at some point we have to buy this other piece of equipment. We're still gonna have to finance it, it's still gonna be expensive, but if in prior years we had capital that's sitting there, that's cheaper money, or so some percentage of a large outlay can be covered with cheaper dollars, right? Rather than whatever the current dollars are, which are always gonna be more expensive. But that's difficult, right? Because, and maybe this is what the sustainable budget part is.
Can I add to that?
Well, 1 second, yes, but one half second. If you have a sustainable budget, and so now this is gonna be my interpretation. If we have like reserve funds and we plot money in, or we get windfalls for different things, and it goes into whatever generated the windfall. If we get a windfall, I don't know, something on the select board budget, then that windfall should kind of stay in the select board pool, right, as opposed to the general fund. Because going into the general fund is great. It serves to reduce taxes. Presumably, it reduces the current, immediately, but what it doesn't do is protect for when things go super wrong, right? And that's where the reserve fund says, okay, for the bridge, like it's just a matter of time before something happens to that bridge. So we need to get as far ahead of it as we can.
And you said there's no funding for that bridge?
Yeah, so
Very
I think we're digging
Reserve.
into
I get
some
that, of course,
details.
but-
Right,
Yeah, we're definitely digging into some
But I
details.
wanna get back to,
Yeah, Mike, you had a
The
comment?
only thing I'm gonna say is just the interest alone you pay on your lease payments. I mean, if you can pre-fund even half, quarter, 3/4 of a percentage of what you're buying and not pay interest on the stuff.
it's
At the end
ginormous.
of the year is a lot of money, it's thousands of dollars. It's not just $200. It's.
Yeah, so
Yeah.
the,
That's a good idea.
Years ago, used to always have, it was, well, before I was doing this, but years ago, there used to be equipment funds,
oh,
truck
yeah,
funds, loader fund, all this stuff, grader fund.
There, and you pay, the hours you used it, you paid into the equipment fund.
Yeah.
yeah,
And
and
then
that's
everything was
people.
there when you
Yeah.
needed to buy.
So why can't we do that again? Because it's focusing
It's
You're
focusing
basically setting
dollars
them
where we need
aside.
to use the same dollars, right?
So give me one or two words to describe that. Do you like the sustainable thing? Cause I said,
That's my interpretation of the sustainable thing.
okay, so do you want to say that's,
Or-
that's your word, that's your goal? To have it be.
And
sustainable?
another definition of sustainable could be that if we had other ways to have revenue in town that don't come from a taxpayer. You mean like,
I mean, like bringing
power company
businesses,
base, yeah.
bringing
That's a
businesses in and
sustainable-
encouraging businesses. That's
Is
more of a
that-
town planning,
That's hard, yeah.
but we could budget for, but it's an outlay, right? But we could budget for. You know,
Okay,
doing something,
so
but
let me just, let me streamline that and say, you would be interested in thinking about other revenue streams.
Well, to me, when you're talking sustainable, that's what I think of.
well,
I
unless,
don't think about, I think about a solid source of income somehow that can help.
but it's like, okay,
Taxpayers.
where do we get 100 acres to call up Amazon and say, you could put a facility, but that's really, right, for somebody. For a little town like ours, that's kind of how you have to do it, right?
In a smaller scale.
Yeah, let's not use that Amazon word.
Right, no, but just to have some big thing, it's jobs, it's rent, it's whatever, I mean, we don't have our own ski mountain, so we have to have something else.
You'll never see that here. This town is stagnant. It is.
Yeah,
Lived here all my life. It is. When somebody
tries.
tries to put something in, they fight it down. So it just doesn't work. It'll always be this way.
What is your budget goal, Rhonda?
Oh, boy.
Make town non-stagnant.
Make the town non-stagnant.
Is it real?
Yeah, it is.
Okay,
that would,
okay.
that'd be
That
awesome.
would be some investment potentially.
Yeah, that'd be sweet. You got any plans?
My two words for, what did you say the word, your word was what, sustainability?
Yeah.
My word was not sustainability.
Resilience.
Okay, but there was the
Resilient.
word that popped up.
And
Sustainability.
reality
Yeah.
based.
Okay.
Reality.
Yeah.
My two words would be, of course, now I just forgot one of them. Shoot, I started to write them down and then I started talking. And the pizza is good.
Mhm.
Somebody else say something, it'll come back to me.
I never had that pizza before. That's so good. That one with the,
You gotta go to Jackson.
I know.
You
Oh,
like the sugar house?
yes.
Uh-huh. They weren't making it for a while around there, it's that.
Oh, really? Oh,
The two words are efficient and stable. So,
Right,
you know, if we can. Of course, this is the word that I always use and everybody looks at me for this word, cut. If we can make a little cut here and there,
yes. I agree.
but yet not hurt ourselves, you know, because there's times you can make cuts that could really hurt you. There's times where certain years on certain things, you can maybe make cuts. And then, you know, that'll come back. So there's certain things that kind of ebb and flow a little bit. There's certain things that need to be, you know, pretty level. But stable and efficient.
I like that.
So where are we gonna go?
I have to stop chewing. Stable and efficient is good, and like, that might also be. Looking for ways to, you know, keep the process moving quickly as flowing, maybe trying to get things through things, easier. Yeah, so thank you all for giving that kind of input, so we have some sense at the end of whether we're close to what we need, because it's so easy to get. By about line, I don't know, 39, I'm like,
To get
I
a
don't,
little
I just, I
slap
want to
happy.
finish, right? So it's good to have that, perspective.
Well, if I could,
Yeah.
before we shift
Yep.
and working into your, how we're gonna end this. I do want, besides the fact, you know, what is next agenda?
Mhm.
How many budget meetings should we
Oh, yeah.
line up?
Mhm.
Because I was looking at we're getting the kind of reports and the money requests coming in.
Mm.
That's all fine. I was looking at last year and I don't know how you guys recall, the last budget meeting that we had where we were adjusting numbers was, I think, in January,
Mhm.
was in mid-January.
Mhm.
I'm really hoping that we can get that done. I don't know if we can get it done by New Year's.
How many meetings do you working meetings do you think has it? taken
Well,
in the past?
Last year.
Like
we had-
2 or
I
5?
was gonna look.
Yeah, let me look. I've got a list
Just a
here.
suggestion, not we, I guess you guys, start earlier, like end of September, beginning of October, like get moving on this and.
We could if all the other things didn't come
Some,
in the
Yeah.
meantime.
Well, I mean.
Yeah.
so,
Yeah.
we're right
Only
in
got
the
a couple
middle. I
meetings
mean,
a week.
well, last year was a
It's
disaster.
gonna be.
We're
things
earlier
like-
this year than last year.
Last
It's gonna
year-
be the
But,
same
yeah.
thing with you this year. You're gonna be pushing January into January.
So last year was a disaster and we started on Pearl Harbor Day. That was our first meeting.
Yeah.
It was Pearl Harbor Day and we had 7 budget specific special meetings.
Okay,
wow.
I think we
Or,
could do it
and there
more.
were 2 that weren't budget specific, but it was primarily,
7 is a lot.
there were 7.
Yeah, yeah.
And that took us, the last one was January 28th, according to this.
So it was like the last day before you could like legally put it into the book.
Yeah,
We were
we
down
were-
to the wire.
It
Yeah.
was.
We
Yeah.
were, and the year before there was a challenge as well, because we discovered the budget problem like mid-January. Where we
No.
hadn't
That's a lot of.
gotten enough tax dollars to do this year.
Thinking all the time.
Okay, so we've got that, desire to kind of keep it shorter and so forth. I would like to have, we've got, put like 2 minutes or 3 minutes on this. I would like to have an understanding at this point, if it's at all possible, to know how did we end the last fiscal year?
I think we had an $83,000 deficit.
Really?
Yes.
That's
And-
insane. Is that-
Well,
yeah.
it is and it
Not-
isn't.
Not how I had envisioned.
No,
it,
yeah,
right?
early on you thought we were gonna have money and I knew
Yeah.
we just, it was, it just,
Okay.
we weren't.
And you're fairly certain of that. at this
I'm
point.
certain of the numbers. What Patty and I have not been able to do because we've been in kind of high speed audit mode because we gotta get the audit done so that they can print it in January. Is to go through and we're gonna do a walk forward of where that 83 came from. Patty has, there's a couple of kind of big things where we can see what it was, but that's what we have to,
Interesting.
I
Okay.
still, I owe you guys that.
So the first piece of our budget is to cover that $83,000 deficit.
I guess, yeah.
And that's with the 70-something thousand dollars from Green Mountain Power and.
Oh, yeah, the 100 came in, but I have to do the walkthrough, so
Okay.
I don't wanna.
That's a ballpark number of with the money.
The,
that came in.
83,000 takes in all the money that came in and all the money that went out. For different things, self-funded, not self-funded, cemetery fund, you know, what went into reserve funds, all of that. So, but Patty and I need to go through and get the walk forward on that number. And so that number, we may say, oh, that's really not the right number. Once we do the walkthrough, we may find that there's a component in there that either is wrong. But that's the last number I saw.
So we don't, so that helps me just, I was trying to say like. In terms of our reserve funds and our allocations, the state law changed to make it easier if we did have a surplus to put money into a rainy day fund. And that would have been one of my first pieces of being resilient would be to say, if we
Yeah.
have a surplus, can we put it in?
But that's
to
not gonna
a fund?
happen.
Apparently,
Yep.
I can scratch that off of the things that keeps me up at night in a bad, in a
Yeah,
in a
so,
not happy way, so.
Apparently part of that 83, so the surplus deficit that we had last year, right?
Yeah.
Was driven by whatever it was driven by, but then there was this other deficit that was also there.
Yeah.
That we just didn't address. Because we were addressing this other number.
Hmm.
So this is why I don't wanna get
Yep,
myself
okay.
into too much trouble, but
Okay.
Patty and I are looking at.
Okay.
At everything and we just need to
Okay, so
hunker down and,
that's
get
one
that
thing I wanna look at, and I think the other thing I wanna spend some time emphasizing this year is. I would like us to look at the equipment schedule. And the reason I would like to look at the equipment schedule is this, and Mike is gonna hate me after this, but I don't, it's gonna have to be that way, I guess. Well, right now, we have 5, count them, 5 big trucks, plus a small truck. When I was on the board before, we had enough trucks for the number of people we had.
right,
Because we also, when Brad was here, they ended up buying a spare truck because one truck got broke and was in the garage all the time.
Yeah, and so what I wanna look at is we've talked, but we haven't, this board has not actually said we're gonna, try to cycle through on 7 years instead of 10 years. We really never decided that. It got put in the book anyway.
Well, part of,
And
Well, it did get decided a few years ago when
I-
Pete and all them were on the board.
I tried to
and,
ask Pete.
and I also have on my list of conversations with the accountant is what is the depreciation schedule and how many years?
Yeah,
So I wanna get her
yeah,
number, cause we've submitted stuff and she's come back, and so I wanna,
yeah.
but that's,
All of that to say, like, if we have one fewer piece of equipment, maybe it will be easier to pre-fund the other equipment. If we don't have that spare equipment, right? Then we're maintaining a smaller
So
fleet.
like right now, your brand new 24 is at the dealership, and the other day when we went out, spare truck was used. This soon in the system already.
Yeah,
So
and
what
I,
is your plan
yeah,
down the road if you don't have a spare truck?
yeah, my plan would be, we have to have the conversation about what is our equipment schedule, what do we want it to be, and what would the impacts of that be, right? But all that to say, it's
Well,
never,
the biggest thing you need to do is. I guess I'll say hypothetically, cause you just said it's not really in the minutes. But is get rid of stuff at 7 years, so you buy a bumper to bumper
Absolutely.
warranty, 7 years,
Sell it and
with all
lose it.
this emission stuff that's going on nowadays. All it takes is one little thing, and it puts it in D-rate mode and you can't even run,
mhm.
so it's like. I
yeah,
mean,
so,
do what you gotta do, but at the
well,
end of the
we,
day, that's
so
what
it
you
feels,
gotta
it
do.
feels like we've been marching towards that. We're doing the 7-year warranties, we're having the longer warranties. But we haven't had a conversation about which equipment is going when. And if we are doing that every 7 years for those trucks, can we get rid of the spare? If everything is under warranty all the time and things are cycling through, can we get rid of the spare? And
But
would
he's-
that save us money?
You're just saying.
We have a new
it
truck
might
and we
not
need the
be in
spare,
stock
so.
for a month, And then you don't even have a spare for that, a new truck.
Our newest truck we got
Is there now,
is a 20, or newest dump big truck is a 23. And it has 10,000 miles. on it.
Yeah.
It's more or less just used for plowing, a little bit of gravel here and there. It's Benning's truck.
Mhm.
They serviced it the other day, and where the brakes chambers or welded onto the axles was all broke right off. So when you hit the brakes, it was just spinning the whole thing on a brand new truck. I mean, you
Yeah.
can't run this truck. It has no brakes
Yeah,
on the one whole axle.
yeah.
And the repair time is. You know.
It all depends what the dealer, I mean,
So you're
it's
down
all
to-
well having to do stuff under warranty, but you're at the mercy of the dealership. I
Okay.
mean, unless you're gonna
You don't
go
have a
back
lot
and
of
buy
fixing.
1989 stuff that you can work on, you're done.
Hey, whatever
I
happened to
like
that
that
truck?
idea.
So-
If we could find some good ones.
Take it?
The
Okay,
guy took the truck, right?
okay.
Oh, sweet.
Back to our meeting. We have just 13 minutes left. So our next budget meeting, we could talk budget on Tuesday for Tuesday regular meeting. Will we have something to work with?
I'm ready to go, yes, I have, yes.
Okay.
Whether we have the deficit or not, we don't worry, that number will come. I may not have the answer to deficit.
Okay.
But we can
Still
talk
have to
numbers.
plug other
So-
numbers.
We have to plug, yeah, that's we need to have that at the end and it's,
Okay.
but that's not a,
So budget is
showstopper.
certainly an option for some of the time for the next meeting. Or
Well-
maybe a lot of the time for the next meeting.
Real quick, I know that the audit stuff is still ongoing, but is everything that we need obviously is now in memory?
No.
Okay,
the conversion is gonna, Patty has started double entering QuickBooks and NEMRIC. And there's variances between the two, so we're running both together. I want to be able to run NEMRIC and QuickBooks side by side for a year.
Okay.
Because stuff happens at different times of the year. But we're not quite there. I think we're in a really good place with NEMRIC. I think stuff is in there. We have a chart of accounts. I still need to take the chart of accounts and apply it to the account numbers that we have here, but that's a kind of Katie key punching. The thing that we don't yet have, at least she may, but I don't have a grasp, is what does the reporting look like? Cause getting stuff in is one thing, getting it out is the other, and so,
Okay.
but I think we're making good progress and she's using it, and so, yes, but it's double entry.
okay, but it's at a point where at least we can, obviously, we have to get through our budget and we can,
Yes, and our accounting for next fiscal year will be based on 100% NEMRIC. So that's what we're to.
So
Okay, what else do we need to
do we
have?
need to do, where are
Well,
we at
what
with
was on the
Whitney
bu-
bill?
Okay, so,
Yeah.
we wanna put something on the agenda next time to talk briefly about Whitneyville. So we had another conversation and we are going to follow the path that we had already laid out with an understanding that road revision is planned to be done as best it can be temporarily this year.
Temporary dash permanent.
Temporary dash permanent, if it, there might need to be repairs in the summer, but essentially that will change that will create a different lower level
Angle, whatever.
angle.
A wider,
So there will be a smaller triangle. There will be the original road and there will be on the town, within the town right of way, another path for people to get to Brook Road.
So pretty much from where the town right away starts down to the culvert that's on there. We're gonna move. So instead of using the other cut through, they're gonna move a cut through to where we legally can and
Increasing the width of the intersection, basically.
increasing more or
So there'll
less.
still be a
like,
cut.
creating a
making it-
turn radius.
Yeah.
We're
There'll still be
making
a cut through then.
I don't know.
cut
Light 'em up.
instead of spending
So-
And I went back to
basically the same
take,
thing.
to
So we-
take pictures
So
of
we just
Bob
need to
and
have a
the.
brief conversation
Hey,
about.
So I just wanna have
On the next
at the
meeting.
meeting, I don't wanna have a
We
rediscussion.
don't
I
have
don't,
Yeah.
to vote anything.
we don't have to
or-
No,
vote.
no, no,
we,
So-
and so I'll bring that in sort of a coherent format. And then the other thing is that.
and how
again,
long do you think that'll be?
I think it'll just be a 5-minute thing, right? I think.
I think that makes sense.
Yeah, we just wanna very quickly say,
This is,
you
this
know,
is what we did, this
this
is what we
this is
did
what
again.
happens.
And this is where we are.
Yes, and we're,
Yeah.
and this is where we are at that given time. And then, that will also allow me to begin to do some of the communication, right? I don't wanna wait until we have the meeting on Tuesday to let people know what we're planning here. So I wanna make sure that that gets on the next agenda. Emily, can you think of anything else that's left over? I still have vacation brain of all the stuff.
Not yet.
I still have vacation,
On the future agenda list,
yeah.
let me pull it up, hold on.
I don't think, is Crater Lake in Oregon?
Yes,
Oh, we went there. It was beautiful.
What, last week?
No, my husband was alive. We went to, his family's from there. Alan was born in Roseburg, Oregon. That's where he was born. So we went to Crater Lake and he wanted to live there. Beautiful. I've never
It
seen
is
such a
gorgeous.
beautiful thing.
It
But
is.
anyway, I wondered if you'd went.
I did not go to Crater Lake on this, not on the.
It's beautiful.
Cool. All right, so,
You didn't share my screen so you could see it, or do you want me to list off what's on there?
you can go ahead and share your screen, that would be great.
That would be easier. Yes, what I have, oh,
Whoops.
so there's
Oh, there we go.
just some check-ins, and then the Conservation Commission wanted to talk about what they do, but then
Yeah.
for all of our stuff, these are 3 of the big projects right
Yep.
here. Well, that last one is in the works.
Yeah.
But the first 2 there, and then these are some smaller ones that we talk about sometimes.
Oh, the older not yet resolved has one that we are resolving today, yay.
Oh,
or-
yep, exactly,
Okay,
exactly. And
All
then
right, so
I would love to get this list down a little bit.
right.
And then
right.
these are the longer ones that have
bridge-
longer processes.
Yeah, the bridge engineering assessment is a good one.
It's huge.
That ties into the budget. So, yes, so here's one to put on is the firm map updates, because I got an email today that said that they are ready, and I was like, well, I guess they're back at work.
These are the flood maps.
Flood maps, yep. So let's put that on.
And how many minutes is that?
I haven't looked at the emails yet. Let's put 10, but it might not be that long.
Let's do 10.
And we did the, so I see their emergency management 101 training. I responded to Paul with my perspective about an additional training that he had suggested. I don't know if anybody else responded to him.
No, I
Um,
mean, I
just
need to
kept
do it.
you-
I just don't know that we
suggested
need,
The link
yeah.
there.
okay, yeah,
You
okay.
did, I think.
Do we need agenda time for that or?
I don't think so. I just, like this, one of the things this list does is reminds me if there's something that ends up being time sensitive, or
Sure.
something like the celebration committee disband request. That would be worthwhile to think about in context of this because there might be money incoming.
Right, and the budget, that's part
Yeah.
of the regular budget. So
Yeah.
agenda wise,
Yeah, so the engineering assessment, it just gives us like a recollection of stuff that's kind of been hanging out there for a while that we haven't addressed. One more thing I'm gonna mention is that I will be meeting with the people for the Guilford gravel grinder, the race that went through town,
Hmm.
which caused
Oh, yeah.
some friction with the fire department. And I'm gonna meet and then bring that information to you guys. I don't think
but that,
that there's.
isn't that on Wednesday and the meeting's Tuesday, so that's not an agenda item.
It's not an agenda item, but I'm just informing people that there will be a future thing, and that was on my mental list of stuff that's ongoing. All right, so it looks like we're not in too bad a shape. Emily and I will pull together an agenda and bring it out to you guys. Try to
So
get
we'll
it
have our
out.
first working session,
Yeah, so we'll have
It's
some
gonna be all
working
budget?
session.
A lot of it.
except for 15 minutes.
Yeah.
It's all budget, except for
Should be all
15?
budget, that would
then-
be great.
and
We
then we're
got some
gonna have-
minutes.
We got minutes to do,
Go over.
and we do
Oh,
need to get
that's
those done,
right.
because they're.
Well,
pertaining- yeah.
that's fine. If we have an hour of budget or an hour and a half, 90 minutes of budget, I don't know how long that takes, but
Okay, cool.
let's say, let's put, Emily, let's put 90 minutes of budget. And then the question is, do we want to start with a highway or select board? Because if it's select board, we want to make sure Patty's there. If it's highway, it makes sense for Mike to be in the room.
Last year, we started with select board.
So
Oh.
that, let's do that.
I just remember that.
Select board is easy.
And it's,
But let me just note that there might not be snow to plow next Tuesday, so maybe we start with highway.
I don't know. Whatever you want to do, Mike.
I'd rather not do any of them, but whatever works for you. I'd rather do it when we know it's for sure not gonna snow, so I'm fine with Tuesday.
Okay,
Start with the hard stuff
let's start
first.
with highway.
Start with highway.
Okay,
All right. Rhonda,
Yes, it is a time. I'd like to make a motion that we adjourn.
did I have a second?
yeah.
I seconded. All those in favor say aye.
Aye.
Aye, the motion carries 5-0. Thank you, everybody, so
and
much.
it is, look at that. 7:57.
That's right, see
Recording
that?
stop, go.
3 minutes. All right, thanks, everybody. Thanks, Emily.
Thanks for the
Be in touch
pizza.
Tomorrow.
Thank
Yeah,
you.
thank you.
Oh, yes. Yeah,
Take some.
yes, please take some.